Hello and welcome to the Nurse Rosa's Insights podcast. I'm your host, Rosa Hart, and today my guest is across the world. Thank you for joining me today, Sergey.
Hi, Rosa. Great to be here. Thank you for having me.
Yeah. So Sergey Vasilenko is calling in from Israel today. We actually met in Las Vegas at Health, which is like a health tech conference. And since he is a founder, that was a great place for him to be. But we were in the same room because we're both nurses, and we were at the nurse hackathon that Rebecca Love got going at Health. I don't remember if you were on the winning team. Were you?
Unfortunately, not,
That's
but
okay.
we had the best idea though.
No, actually, we had the best idea. Which one was yours, though?
We'll take it offline.
Okay, we'll do that offline. Oh, might be proprietary information at this point. We want to put some
No, no,
respect.
we just in a nutshell, we had this idea of application that kind of uses AI, of course, to track and share information about pressure wounds, and like a community of nurses who are specialists on that and can go and ask questions in real time and get advice, which actually I loved very much.
Yeah, definitely. And I really loved that accessibility that was part of that idea. I think my group's idea was to work on staffing, and our theory was that we're always trying to get people to come in and cover shifts and things like that. And in our experience, our six people at the table, we were talking about how it's the people that you work with that really make it a great work environment. And so, if we could work on staffing with people who get along with each other, and staff consistently that they work with the same team over and over again to really build those bonds. So they're like, oh, I want to be there for my coworker to support them. It means a lot more, and you get a lot more stability. And there's so many young nurses right now that are less experienced. So if we could have like an experienced nurse, then make sure we have an experienced nurse with baby nurses, for lack of another term, to kind of balance that out so they don't feel as scared and things like that. Really taking into account the relational nature of coworkers into the staffing for the purpose of retention. Because I think when leaving that out, we're just not looking at the whole picture. So, um, oh
Actually,
well.
remember your idea, yeah, and it resonated with me very much because it kind of relates, well, maybe slightly, but still to what I do today in in-house health.
Right, exactly. So tell us more about in-house health. Well, yeah, tell us what that is, and then we'll do your backstory.
Yeah, sure. So we're kind of starting from the end to the beginning. Well, I'm a CNO of in-house health. We've been around for around 2.5 years, and we are a predictive scheduling platform with a focus on the predictive part of it. There are many different scheduling and staffing platforms out there doing all kind of things, automations or fancy UIs or whatever. Basically, it kind of replaces probably the Excel, and if you go in deeper a bit, it probably simply replaces pen and paper. Um, we are trying to solve a problem of nursing shortages. Well, you can't really solve a problem of nursing shortages. It's a huge, huge, huge problem, but it kind of relates to retention issues, to burnout issues, you name it, issues. And we hopefully want to try to ease some pain points here by giving managers, nursing managers on different levels, data-driven tools that will enable them to understand how many nurses they need into the future. For example, if you're a unit manager and you're doing schedule, I can tell you with a high level of precision how many nurses you're going to need, let's say next Wednesday morning and next Thursday evening, and so on and so on. Now, you can be like, hey, but people kind of know that, right? I can't beat that. People kind of know that. And if you're an experienced unit manager, you know it pretty well. But still, there's some level of uncertainty. Maybe this will happen, and maybe this will happen. Maybe I will have some more procedures to do. Maybe I will have some less procedures to do. And what we have learned in in-house health, that there's always psychological padding. We call it psychological padding because you really have to be ready for the next patient to come, and she has to have a bed and a care provider. And a care provider is a nurse. There is no option where a patient comes and she doesn't have a bed and a nurse to take care of. So we gotta start a little bit more. Now I can take this little leverage and say, hey, I have data-driven decisions. I can give you the precise number, and then you can use and utilize your existing workforce in a better, smarter way.
Well, any help we can get in being more efficient with
Oh
that,
yeah,
right?
oh yeah. That's true. That's true.
We will take it. So, tell us what informs your background.
Well, so I'm a bedside nurse. I spent 8 years in the neurosurgical ICU, a big one, a tough one in big hospital in Tel Aviv. I was shift manager, I was clinical instructor, all that. And at some point, after 8 years, I decided I want to do something else. I was feeling kind of tired. I was feeling kind of burned out. I was feeling kind of sometimes frustrated. Don't get me wrong, I really enjoyed what I was doing. I loved that ICU setting, the technology setting, the high acuity patients. I was pretty much in love with my job, but all this pressure, stress, I had only too many shifts where I couldn't have go eat lunch because there is something happening all the time, and or during the nights, you simply sometimes feel that you're overwhelmed and you're running in the turbo mode week after week after week after week, and it affects you. And then I said, okay, let's stop for a second. Let's see what goes on out there. I don't know. There's this issue with nurses. They kind of see the healthcare, they kind of see the hospital, they kind of see the unit, and they kind of see their shift. And nobody knows what's up there. There's huge, huge, huge world out there, and we're kind of seeing this coming to life more and more with nursing innovation, with all this movement around. It's great. It's a blessed thing. But back in the time, I had no idea what I could do else with nursing. And luckily, luckily, I was accepted to a role in a health tech company, and my manager back in the time had this strange idea that I could leverage and use my clinical knowledge to do QA stuff, technical QA stuff, which turned to be absolutely wrong. I never used my clinical knowledge with what I was doing.
Oh,
But
no.
no, seriously. But on the other hand, I did have this ability to manage things, to be attentive to details, as many nurses do, work under pressure. All those things gave me this ability to survive in the absolutely new and unfamiliar setting. And I started doing okay, and I started doing even fine and even good, very much good. Uh, I was promoted to team lead. I did integrations and I switched companies. I did some integrations of EHRs, some in Europe, dealt with medical devices, moved to directorial role in my last company, a Texas-based company. And fast forward 2 years ago, 2.5 years ago, I met my current boss, CEO of in-house health, Ari Brenner. He was visiting Israel back in the time. We had a cup of coffee, and the rest is history.
Nice. Yeah, I love how you went into, like, this thinking, "Oh, I'm gonna bring my clinical knowledge to inform this health tech innovation," and it turns out it wasn't so much your knowledge of the clinical, but it was the skills that you practiced as a nurse that were then transferable into that new space. And so that's something I've heard a lot of people talking about lately is the transferable skills that we really learn as nurses, whether it's the attention to detail or really the working under pressure. And I mean, that's a big deal. So,
Yeah, I think the attention for details is something that is very, very important because at some point, you deal with humans' health and humans' life, patient health, and then you go and do something else which is not directly related. I mean, if you do a severe error by mistake, then in ICU somebody can die. Well, in the other setting, probably nobody will die. Yes, there will be financial impact. There will be a lot of stress, and then production will be down. But it's still not as somebody is dying, and but you still have this mindset. You have zero margin for error or very low margin of error. So you're always attentive to what's going on. You double check, you triple check. You always do your work very thoroughly,
Mhm.
and this is a difference
Yeah. Well, that sounds like an important skill set. So then when you went into um, tech, how did you go to become a co-founder of In-Home Health?
in house health.
In-house health.
Uh,
I'm sorry. I
oh,
use
good.
those interchangeably. Whoops.
Oh, good. Yeah, house harm. Yeah, I'd say. Oh, good. Well, I was like I mentioned, I found myself between several companies. I did always stay around health tech because this is what I love. This is what I do. This is what I understand. And one of the trade-offs I did not want to do was I'm going out, I'm leaving the bedside, but I still feel that I want to do this impact on people's lives. And this trade-off, I wasn't ready to make it. So I stick to healthcare, health tech, and after my last role, when I was looking for my next challenge, I met Ari, and he proposed me to establish a company with him. I was the first one to join, or well, what was the second one, depending on how you look at it. I was the first follower. And on the other hand, I had other proposals, but not from the healthcare world, not necessarily related with health. Like, I don't know, I had to weigh my decision to read thoroughly, but I said to myself, well, this is an adventure, but it's still about health tech, so I'm going to do it. And every time you move forward, it's like I always find myself out of my comfort zone. I can't say it's easy. It's actually not easy at all, especially given I'm not 20 years old. But there's only one way forward, I would say. And when you move that extra step up, you suddenly find yourself in a totally different position, totally different world. You see things that you could never seen before, and it's still as if I was doing that first step, stepping outside of the bedside, and suddenly realizing there's a huge, huge, huge world out there, and so much can be done, but you don't see it because you have a tunnel vision when you do something and you
Mhm.
want and you stick to it all the time. So be brave. It's not simple, but you get to see things.
Yeah. I've been really encouraged because I had 8 years in the ICU as well. And I also got burnout before COVID and needed to transition, but wanted to keep taking care of patients. So now I called them instead of working at the bedside. But it was amazing to find out all the different roles that nurses can play, even like in the healthcare system, even when you're not building a new company out of thin air. Um, but I think at the bedside, it's like you can't imagine anything different. Like all you know is what you see, and they really don't tell us in nursing school what the
No, oh
options
no.
are. I don't think they want us to know.
You just want to, I remember myself, you just want to survive your next shift. That's it.
Mhm.
That's it.
You're in survival mode for real.
Yep.
Yeah, so I'm really glad that you're putting your story out there so that people can realize, oh, well, if he can do it, maybe I can do it. And so when you came to conferences like Health in Vegas, um, did you join like the nurse approved section or were you in the like,
Nursing Innovation Pavilion, for example, if you're talking about this particular setting, I do travel. I mean, I'm far away, and traveling that far away isn't simple. So I go to hand-picked and selected conferences. For example, I came back about what is it today? 1st April, I would say a month ago. I came back from Dallas. I had a speaker session on
Mhm.
TONL, Back to the Future panel. So I enjoyed it very much, and I especially loved the Back to the Future theme because well, it made me rewatch the movie, and I forgot
Right,
how cool Michael J. Fox is.
right. Talk about an advocate for improving healthcare, right?
Yeah. Oh yeah. exactly. So it kind of comes together. Yeah, well, funny story. So when I was flying to Dallas, I stopped for a couple of days in New York. We had this investors dinner with Ari, and I was invited. So I was because I was traveling, so I could attend. And I knew I'm going to Dallas the next day. And the session, like I mentioned, it's called Back to the Future panel. And guess what? The place we were eating at, we had this reception. 50 people came, and there was a huge poster on the wall of Michael J. Fox, but from a different movie. And I said, "What are the odds of that?"
Right. He's just getting around, isn't he?
Oh,
Yeah.
you don't see that much, But given the situation, I was like, "What are the odds for that?"
Right? Maybe it's destiny.
And
Or
it's
it could be
destiny.
like, I just got a blue car after driving a red van for a long time, and I hadn't noticed many colors or many cars that color before, and now that I'm driving, it's like I see it everywhere. And
Yes, you just pay attention. Your brain snaps, and it
Mhm,
just pays attention to what you've been like ignoring previously.
mhm, exactly. So, let's talk about your vision for how you see you can improve healthcare. I have to ask you the billion-dollar question, which is if you were given a grant for $1 billion to meet the needs you see, how would you like to see it used strategically to have the most sustainable impact?
It's a great question. It's not an easy one because there are so many ways to spend that money. But I think if I had to give you one question, I would probably go after. I would love to improve the access to healthcare to people, like help people access healthcare, and it's very high level. Now, if you just let me explain what I mean by that, because when we say healthcare, we both understand how huge this word is, how huge this idea is. One part of it, probably, I would probably invest into accessing people in preventive healthcare, because the America and Americans spend a lot of money on healthcare. They're somewhere in front of the whole world, probably, or first or the second place, somewhere between that. And the healthcare outcomes are not necessarily great. They're somewhere in the middle. They're not bad. Obviously, they're good. They're very good, but compared to the amount of money spent, they're mediocre. And there's one problem that I could immediately spot on after dealing with US healthcare for at least the last 8 years. I would say uh, you are very good by treating already existing problem, but you don't invest enough money into preventing the problem. Okay. And if you can prevent the problem and invest in preventive healthcare, you could probably save a lot of money by treating less severe disease or less severe condition before it becomes chronic or before it becomes an issue, like cancer screening, or you name it. I don't want to go into clinical details. Now, this is the first, yeah,
But I think it is important to talk about how, right? Because, I mean, we have definitely got a whole Make America Healthy Again movement going on right now. It's very popular to say we want to make America healthy again. But let's talk about how. And if you only have $1 billion, then you've got to be strategic with it, right? So when you say prevention, would you be thinking more like mobile primary care buses that go around and do screening and assessments and providing that primary care model? Or would you be thinking more about um, investing in food sources and sustainable agriculture that would provide everybody with the nutritional building blocks that they need? Like when you say prevention, what do you mean?
I would probably go for the option number one if you gave me this dichotomic option. I mean, America is a vast, vast country. It's huge. And I do know that many, many areas are not easily accessible and they simply don't have, like, they need to drive 2, 3, 4, 5 hours to the nearest medical center. And I mean, technology comes in and you have all kind of solutions that are emerging right now. And if you go to any given conference, you'll probably hear about it, right? Telemedicine, you have the home hospitals, which we also have here, by the way, and you have your virtual nursing and all that. So I would probably say make screening medicine available and well understood and well known both by the providers and both by the clients of the healthcare systems. If a person reaches a certain age, that person should probably go and do one, two, three colonoscopies, mammographies, I don't know, pap smears, you name it. I think there's a huge lack of desire from the healthcare system to promote that, and there's huge lack of understanding from the client side, and or because it's expensive, because it's not accessible, and so on and so on. It's just one piece of it. Even let's just switch to a different setting. For example, if you're already in the hospital and you are being treated, the access to caregiver within the setting should also be not a big deal. For example, if I'm thinking to my side, to what I do and what I care about, like fair and right staffing ratios, because I previously mentioned I had only too many shifts where I wasn't even able to eat lunch. If I'm not able to eat lunch, probably I'm not able to take care of all the patients in the best way, because there is something wrong with the staffing, where there's something wrong with too many patients, too many acute patients. Now, if you make sure you staff correctly in the best way on that given unit, it means the person already hospitalized, already accessing healthcare system, already inside the healthcare system, still gets the attention he or she needs. I've seen those caricatures, those little doodles where like there are people standing at the nursing station and they be like, nurse, 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 and then you can see like a different picture. There are a couple of nurses hiding behind the door, and there's nursing, this little room, restroom or whatever. Like, are they gone? Are they gone? It's
Like
so
you have
so
time to hide.
well, yeah. So it's like a spectrum. One is high, high, high level. How do I make sure this particular person living Midwest somewhere like very, very not accessible area gets healthcare attention? But on the other side of the spectrum, if I'm already inside the facility, how do I make sure somebody takes care of me? It's kind of the same.
Right, because just being in a certain location doesn't guarantee that you are going to have access to good quality care with people who are mentally prepared to provide it. Yeah, and that is tricky. I know something I've really enjoyed seeing is the development of these mobile units that do preventative screening, or there's one here in Louisville that they will have a primary care clinic come out to like a place where homeless are to provide them with primary care where they are, because getting somewhere when you don't have a car and might not
Yes,
have shoes is tricky.
even on a small scale, and like Israel is so tiny compared to the US. It's like there's nothing to compare. It's like I don't know. Even on our small scale, where virtually every location within the country is probably not longer than 1.5 hours drive, and I'm talking about the extreme cases. Like, wow, this is like unimaginably difficult. You probably can get to nearest big hospital driving 90 minutes. I don't know what the average is, but maybe 20, 30 minutes average if you take all the country, which means in your perspective, walk in the hood, right? Even here, there are initiatives where those like mobile units, for example, especially around the months of awareness, like there was
Right, exactly. Like if it's like breast cancer awareness month,
exactly,
then the
exactly.
mammogram van will come
Exactly. So
and you
we
can
have
get
it
your
here too,
mobile
and it's
mammogram.
exactly. It's very welcome. You have this pink colors. There is this bus driving around, going to small like places, and then stops there. People, it's mainly made for awareness, mainly because if I want to access the particular service, I can easily do it. But it's like for awareness. Hey, look, we offer that. You should probably know about that. So, yes, this is exactly the things that I would like to see more.
Yeah, definitely. And virtual mental health care can be. really
Yeah,
impact.
there's a lot of I mean, I'm speaking to a lot of nursing leaders and nursing innovators, and I think there, I didn't mention it, but the mental health is really getting a boost right now. I've seen so many different ideas and so many different platforms emerging, like applications on the phone that track your, not necessarily physical, but more with focus on the mental health, your stress status, your well-being status, and all that, especially even within the community of the nurses. And it's very much welcomed. I mean, if you can get some help or some attention, or even the awareness that, hey, you need to stop and you need to drink some water right now, well, yes, why not?
Yeah, exactly. And so much of it when it comes to mental health is being aware of our body and how our body is responding to things. I feel like us as nurses, we're really good at pushing through and neglecting our own needs. And I'm working with Power Up Nursing, and we're doing this pilot program with the ultra human rings measuring our biodata, right? And
Nice.
measuring sleep, and also it will give you like a stress reading and things like that. And I had a doctor who was talking about how I wish we were just people need to just be in tune with their bodies and not use all these devices. But as a nurse, I was very not in tune with my body because I needed to ignore my body in order to do my job a lot of the time. So I feel like it's helping me to learn to be more in tune with my
This
body.
is, yeah, this is absolutely true, and it totally resonates with me. You're ignoring your needs because you're always dedicated to the patients and or next whatever need of the unit and on the shift. Yeah, you want to sleep, but you can't because it's night shift. I mean,
Right?
as simple
It's
as
like,
that.
"The sun is too bright. I can't sleep during the day."
I can't sleep. Yeah, I want to
Mhm.
sleep.
Yeah, so learning what works for you is important too. So I really appreciate your dedication to making things better even across the world, and I hope I get to see you again in person, maybe at another conference one day.
Yeah, definitely looking forward to it. Thank you very much.
Yeah, definitely. And if you've enjoyed this episode of the Nurse Rosa's Insights podcast, definitely follow wherever you're listening right now. It's on YouTube as well as all the audio platforms. I'll have Sergey and in house health information in the show notes. And then feel free to follow me as well on all the social media platforms. I'm at Nurse Rosa Speaks, and we'll see you in the next episode.